Thank you for joining us this evening. Really appreciate you all being here. My name is Ainsley Faraday. I'm the program director for the UCSF Acute Care PT Residency program. I'm also an alumni of the program as well. So I know it in and out in all the good and the bad ways, because I've been through it myself and I'm now the director of it. I'm also a PT here at UCSF. And I went to USC for my DPT program. So yeah, I'm excited to share some information about the our residency. And then we have Ash Haller here, who is our alumni participant as well, to answer any questions that you all may have. So here's just some program details. So it's a full-time program that's 12 months long that begins in September and runs until the end of August. It's fully accredited. And it's based at the UCSF Parnassus and the Mount Zion campuses. We have one-to-one mentoring that happens 4 to 5 hours a week, but you will very much so exceed that. You may have a full day, full 8 hour day of mentoring. We also have really great opportunities for teaching within our UCSF SFSU DPT program, which is about 4 hours a week, which we can talk about a little bit more in depth later. We have weekly didactic instruction that complements all of your clinical instruction and mentoring very well. And then a minimum of 25 to 30 hours of patient care a week. So it's a busy year. The year schedule looks at and goes through various rotations throughout the year. So here are all of the rotations that you would do. We have cardiopulmonary and vascular. We do arthroplasty at the Mount Zion campus, neurology and neurosurgery, hematologic oncology, which is something that's very unique about UCSF and our program, is that population, medicine, transplant, and then time in both the medicine and the surgical ICUs, which I would say we also have a higher emphasis of critical care compared to other residency programs. This is an example of what the year would look like. So you would start with orienting in September, and then your first big rotation, which would be cardiopulmonary and vascular, happens in the fall with a written and a live patient exam. That's what LPE stands for. At the end of that rotation. And then you go to Mount Zion for your arthroplasty rotation, and then neurology in the winter, in the new year. And that's when you would also have another written exam and a live patient exam during that rotation. And then you move to the oncology service, transplant, and medicine with another written and live patient exam. And then you would do your critical care time at the end of the year. And then in August, if you're within good standing of the program, that's an opportunity for you to do an elective rotation on any of the services that can support an elective rotation at that time. Also, if you would need to go back and repeat a rotation, for example, if you struggled more on neuro and you just want more exposure to it, you could go back to the neuro service for that last month. So we really cater the year to each resident, because not every year is the same and every resident has different interests and different strengths and weaknesses. So we do offer quite a bit of flexibility and adaptability of the year, which is very nice. This is an example of a weekly schedule. So you can see where you would be in your patient care hours. And then another thing that's very unique for our program is we have one day a week that's dedicated to residency activities. So again, that really helps with work-life balance and making sure that you're doing your assignments and you're studying and you're teaching in an effective and efficient way. Is you have one full day where you are out of patient care working on all of your projects. So this isn't the exact schedule because the days might be different, but this is just a good review of what that week might look like. And again, you have a dedicated mentoring day as well. So you can utilize that day as you see fit with your mentor. So a lot of adaptability and personalization here, which is really nice. So our faculty, I know Allison mentioned we actually, in her slides, that we had fewer mentors, but we actually have now increased that. We have 16 mentors total. We have 16 people that are involved in our residency, which if you're choosing a program, you really want to focus on the faculty and the mentors that you're going to learn from. That's the most important aspect, I would say. So we have a really wide range of mentors with all different specialties and interests. So we have 2 cardiovascular pulmonary specialists, 4 neurology specialists, 1 geriatrics, and then just a wealth of knowledge and experience in all areas. Some additional opportunities that our residency offers is QI work. So that means quality improvement work. That's research based, finding problems within our hospital system that you want to change, that you feel passionate about. And you are paired with a mentor. We now have 2 mentors actually that really focus on QI work and will be kind of your project manager throughout the year. So you're very well supported with this project. And it's, yeah, again, something that you feel really passionate about, and that you can hope to make change within our department and within our hospital system as well. Um, we have a lot of teaching opportunities within the UCSF SFSU DPT program. We do morbidity and mortality case reports. So that is where you would pick a patient that you've really had a challenging go with, or they've had a really complex hospitalization, and you present the case to the rehab department. And it's a really great self-reflection, a really good way to get closure on some tough cases and also learn from your mistakes and other people's mistakes and what we maybe could have done better. Department and National Journal Club participation. So the acute care residency, residencies across the nation meet once a month for National Journal Club. And so you would be responsible for presenting a journal club 1 month out of your year. And also the expectation is that you're attending all of the other journal clubs. So it's a great way to network with people across the country, which is really exciting because the acute care residencies are just growing. So it's really, really cool to see. And then you also do this within the department. So you are responsible for presenting 3 journal clubs to the rehab department. With your QI work, you hopefully have the opportunity to present your research at UCSF-based research symposiums, and then also national conferences. So we've had much success with all of our residents being accepted to CSM and being able to present their posters, and even submit for like platforms as well. So very cool opportunities. And then also we have many continuing education opportunities as well. These are some fun photos I wanted to include of past residents and us just doing cool things. Ash, that's their poster at one of the UCSF health symposiums presenting their QI project, us at continuing education, conferences, things like that. Some deadlines that Allison mentioned in the main group, but we can just review it because I know it went quick. So our application cycle is open with RFP TCAS. They close March 1st, and then invitations for interviews will be sent out mid-March. And then interviews take place hopefully at the end of March. So you still have quite a bit of time to get your applications in.